Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. The new year has already seen record numbers of positive COVID-19 cases, and hospitalizations are at their highest in more than a year.
More than half the children admitted are spending time in the ICU, and at least 40% of those are spending time on the ventilator.
Ahead, we'll talk with a medical expert about the latest on the virus's impact on hospitals. Farmers die by suicide at 6 times more than the national average, and the pandemic has only added to the stresses they already face.
Every farmer don't think it could ever happen to them. You know, we never thought it could happen to Blake.
The Indiana Rural Health Association has designed a program to address mental health issues on the farm. And as church attendance declines across the country, smaller churches have had to make hard decisions. Those stories, plus the latest news headlines, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. The Indiana Department of Health approved boosters for Hoosiers 12 to 15 years old this week. The move comes after the state reported a single-day record, 15,277 new cases Thursday, bringing the total number of positive cases to more than 1.3 million. Monroe County set a single-day record Wednesday with 297 new cases, and the county's 7-day positivity rate has climbed to almost 19%.
These numbers moved our advisory to a 2.5, which is still orange, but we are quite likely on the road to being red.
More than 3,000 Hoosiers remain hospitalized with the virus, the most in more than a year. The state has added 150 new deaths Thursday, bringing the state total to just under 19,000. We're joined now by Dr. Paul Calkins, the interim chief medical officer for IU Health South Central Region. Welcome to the show, Dr. Calkins. You know, as we just heard, more than 3,000 Hoosiers hospitalized in the state with COVID-19. You know, we hear these numbers, but we don't see it. How much stress is that putting on the healthcare system?
Well, it's putting a tremendous amount of stress on the healthcare system, actually. And just so you know, IU Health's top 600 inpatients for the first time ever in the pandemic today. It's just extremely intense right now. I believe we're 5 waves into this pandemic, depending on how you count, and people are exhausted. It's really becoming really kind of more than you can take to just have this surge after surge after surge. And I think the other thing you need to recognize is that we have certainly thousands of people who have delayed surgery because of the pressure on the hospitals, and many other people with other medical conditions that are having to wait because we just don't have the capacity to take care of them. So once we finally get through COVID, we have a whole nother population of people we need to take care of.
You know, the majority of the cases we hear are the Delta variant, but Omicron rapidly on the rise. We hear it's more transmissible. What kinds of challenges does that pose?
So I think we should assume that Omicron is rapidly becoming dominant. The state published some new variant information, and they were calling 50% of their sequence variants Omicron as of the 10th or the 20th of December, so the week before Christmas. So at the rate that that's growing, I think we have to assume that Omicron has become really pretty dominant in Indiana. Apparently it is less likely to cause hospitalization, but there's just so much disease that we're very worried that we are not going to see any relief in the hospitals from Omicron.
Riley Children's Hospital said admissions of children is 4 times higher than at any point in the pandemic. Are you seeing those numbers at IU Health?
So in the hospitals here down in the southern part of the state, we generally would not keep children with COVID. If they needed to be hospitalized, we would transfer them to Riley. So our patients tend to be young, middle age, up into the elderly population. I will say that the 0 to 19 patient demographic is actually the highest number of COVID cases that are recorded in Indiana. And with the numbers being as high as they are, it's not surprising that the number of hospitalizations has gone up. It is fairly striking at Riley right now.
Doctor, thank you so much for your time. We know you're busy, so we appreciate having you here today.
Thanks for having me on.
Suicide rates among farmers are 6 times higher than the national average. It's a problem that has persisted for decades and is only made worse by the COVID-19 pandemic. Brock Turner has this report.
Kathy Walker knows this is an uphill climb. Walker is leading the Healthy Minds, Healthy Lives program for the Indiana Rural Health Association. Today, she's getting the word out about a new workshop designed to address mental health issues.
The biggest challenge for us is getting some of these hardworking farmers and agricultural people to be willing to open up and talk about this.
Kevin Cobb is one of the few farmers who isn't shy when talking about mental health, but it wasn't always this way.
Every morning we'd go to the gas station down here, get a Honey Bun, Mountain Dew or whatever, and you know, solve the world's problems there. And then we'd talk on the phone probably an hour a day, back and forth, and you know, and then at a lot of sporting events we'd see each other. You know, I wouldn't be afraid that in a 24-hour day, I probably talked to Blake more than I did to my family, my immediate family. You know, we were that. You know, and he had a lot of friends like that. I mean, he talked to a lot. So, I mean, he was just he was a good dude.
His cousin, Blake Cobb, who was one of his closest friends, took his own life almost 2 years ago to the day.
He's maybe a half a mile from us. The crow would fly straight across. The scary thing about it is, you know, I mean, he was one of the most liked people in the community. Everybody, I mean, nobody ever said anything bad about Blake. He probably sold seed corn for 16, 17 years maybe. He's a little bit younger than me, but yeah, he's a pretty good feller.
Cobb says many of the stressors farmers face are financial. Those are amplified among small family operators who feel the extra pressure to keep their generational family farms going despite numerous challenges.
Every farmer don't think it could ever happen to them. You know, we never thought it could happen to Blake. Never, ever did I think Blake could ever do it. I mean, he would be the least one in our running group that I would think that could do it.
That's why advocates like Walker are attempting to meet farmers exactly where they are. She plans to host workshops and listening sessions throughout Indiana that will bring farmers together to talk about mental health. Federal funds first allocated to Indiana's Department of Agriculture make the program possible. Abby Heidenreich's team at Purdue Extension was also a recipient. She produces a podcast about stress on the farm.
It's emotional to admit weakness, that you can't handle something. But that way of thinking is what we're trying to help shift. I think, you know, over half of the people in rural communities aren't fully aware of the mental health issues that farmers are dealing with. You know, you have to almost experience it firsthand to really understand it. And that's something that we're trying to change through our programming and just through advocacy for mental health resources.
Heidenreich and Walker both admit their programs are initial steps to solving a generational problem. Everyone involved agrees more funding, additional mental health providers, and other resources are needed. According to the CDC, suicide rates in agriculture are worse than almost any other sector. For agricultural workers, the rate is 36 per 100,000, which trails only mining and construction. Cobb welcomes their efforts and believes more needs to be done, but he admits for many it takes a tragedy before they recognize how dire the situation really is.
And most people, if you don't know them or if it not happened to somebody that you know, you just kind of brush it off until something like this does happen. You know, it's unfortunate that that we see it that way.
Kopp says he speaks out because he doesn't want another circle to have to endure the pain he and his community have. That's a large part of what drives Walker and other advocates. She sees this program as a first step and knows she's running a marathon.
What are some of the challenges that you anticipate?
Getting them to come to the workshop and talk about it. You know, I mean, I've had a number of people stop by our booth, and we have these brain-shaped squeeze balls, and there's a lot of jokes and lightheartedness about the topic. And that's fine, I understand that, but at the same time, you know, we need to have, it's not really a laughing matter, but it's a serious matter, but we can approach it with humor, but we also need to approach it realistically and talk about it and not just laugh it off or shrug it off.
For Indiana Newsdesk, I'm Brock Turner.
We're joined now by Holden Absher for a look at the latest headlines. Hi, Holden.
Thanks, Joe. The 2022 Indiana legislative session opened this week with the GOP again maintaining a supermajority in both chambers. And the House Republicans went to work immediately on a bill that would effectively ban private companies from enforcing COVID-19 vaccine mandates. The measure, which has cleared through committee, does allow businesses to require weekly COVID testing for employees who refuse to get the vaccine, but it says those businesses can't charge if the employees for the tests. Bill author Representative Matt Lehman says his measure is trying to walk a fine line.
That place between an employer's right to do what employers have a right to do as private enterprise, at the same time not interfering with the firmly held beliefs or the medical conditions of their employees.
Every major healthcare and business organization in the state opposes the overall bill. On the other side of the aisle, Indiana House Democrats want the legislature to spend some of the state's $4 billion surplus this year to help support struggling Hoosiers. Minority Leader Phil Giaquinta says the state should be helping Hoosiers with medical debt, child care costs, and student loans. With tax cuts on the agenda, Giaquinta says any debate should include creating a child tax credit. His caucus is also pushing for paid leave legislation.
No Hoosier should have to choose between caring for a loved one and a paycheck. Paid leave isn't a perk. Paid leave is a necessary and fair policy for creating stable and secure economies and households.
This year's legislation is set to end in March. The 4-month remonstration window to petition against Bloomington's annexation ordinances is over, and petitioners say they have enough signatures to stop it. Mitch Legan has this report.
Monroe County commissioners and residents against annexation marked the official conclusion of remonstration Thursday evening at the Monroe County Courthouse. Leading the charge is Margaret Clements. She says hundreds of residents mobilized during a pandemic, going door to door, gathering signatures to void annexation.
I think it's an important time to have a discussion of how we would like to evolve together in the future. It cannot just be an authoritarian top-down. The city gets to tell the county what they want to do to them.
Indiana law states if 65% of landowners remonstrate, then the annexation is invalidated for that area. If 51% of landowners remonstrate, they can fight the annexation through the court system. Clements says she has enough signatures to void annexation in all 7 areas. The official remonstrance record is kept by Monroe County Auditor Catherine Smith's office. She says there are still more to count, process, and validate before it's official.
I expect to have some numbers soon, although those numbers would be with a margin of error, maybe 5%. So ones that are overwhelmingly one way or the other, we'll have that a lot sooner.
Smith says official remonstration results will be issued by the Monroe County Commissioners. If annexation ordinances are voided, the city could challenge most of the signatures in court. For Indiana Newsdesk, I'm Mitch Legan.
If annexation succeeds, more than 8,300 acres and 14,000 people will be annexed into the city limits in January of 2024. The man who barricaded himself in a hotel room at the Indiana Memorial Union Monday night was charged with 3 misdemeanors related to the incident. Cecil Lamar Gilbert was charged with intimidation, criminal trespass, and false informing. Bloomington police say Gilbert claimed to be armed with an AK-47 and holding a family hostage. The situation started around 9 p.m. Monday and concluded around 2 o'clock Tuesday morning when police used non-lethal techniques to get Gilbert into custody. He is currently being held at the Monroe County Jail. While some colleges are delaying a return to the classroom this semester, Indiana University is not one of them. The university said the decision to resume classes Monday as usual was carefully considered, and it will continue to aggressively manage the health and safety of its campuses. IU requires all of its students, faculty, and staff to be vaccinated against COVID-19 with very limited exceptions. It's now incentivizing students to get booster shots by giving them a $20 Crimson Card credit. That's all the time we have for headlines. Back to you, Joe.
All right, thanks, Holden. Coming up next on Indiana Newsdesk. 9 Hoosiers face charges or have been sentenced for their roles in last January 6th's insurrection at the Capitol. Ahead, we look at the status of their cases. And smaller churches have had to make difficult decisions due to shrinking congregations and the pandemic. These stories and more right here on Indiana Newsdesk.
Year after year, PBS has been bringing you the news you trust.
We care about the things that are going to affect the lives of each and every American.
The in-depth analysis you need.
What we normally see in these big crises.
And the true stories that have to be told.
We're a place that people can come not just to find out what happened, but why it matters.
It's all thanks to the support of viewers like you. Thank you. And stay tuned to America's most trusted network.
Your favorite member benefit is getting better and bigger.
This is wonderful.
Over the next year, Passport is adding new shows and doubling the number of episodes for you to stream.
They give us all that they've got.
From your favorite cooking and travel series.
Even the stairs are breathtaking.
To history specials and award-winning documentaries. Better and bigger.
That really is the fun part.
Stream on any device with Passport on the PBS Video app.
Welcome back to Indiana Newsdesk. It's been 1 year since thousands marched on the U.S. Capitol to protest the results of the fair and legitimate 2020 U.S. presidential election. In the time since, at least 9 Hoosiers have been charged with crimes related to the insurrection. Brock Turner has been following their journeys through the legal system from the beginning and joins us here with more. Thanks, Brock, for being here. So do all the Hoosiers face the same charges from the insurrection, or how does that work?
No, they really don't. A lot of Hoosiers face significantly different charges. Some face pretty minor misdemeanor charges for entering public places that they weren't supposed to be, controlled grounds at the Capitol. Others showed up to the Capitol that day with weapons and face pretty serious felonies and pretty significant potential prison time for those crimes.
So for all those that were sentenced, have they served their time?
No, the legal proceedings vary. Some have just been charged and are awaiting initial hearings. Others have accepted plea deals. So for example, John Schaefer, the first insurrectionist from Indiana that was charged, he was actually the first insurrectionist that was charged across the country and happened to be from Indiana. He was a singer and a guitarist in a heavy metal band. He has agreed to work with authorities for those crimes and has agreed to testify for some of his roles there. So it really varies. Some have faced significant prison time. Others have had to complete some community service.
We've heard a lot about companies that have stopped political donations to Indiana representatives who voted to decertify election results. Do you have any updates on that?
Yeah, so some companies are still following those guidelines. Obviously, it's not an election year for Congress, so it'll be really interesting to follow that moving forward. But specifically and most notably, Eli Lilly resumed political contributions to those to several of those congressmen and women. So it'll be really interesting to see what other companies do, as we continue to move forward.
Just have a few seconds left. What have we learned from all of this?
I think a lot of these individuals are everywhere. These folks have come from every Indiana community. They come from different backgrounds, different places, and they're really embedded in their communities. Some are school teachers, some work at significant companies, Cook Medical being one of them. So I think it really, or previously worked for Cook. So I think it really varies, and these are people in the community that are teachers and neighbors.
Brock, thank you so much for that report. Appreciate it.
Thanks, Joe.
Well, even before the pandemic, church attendance was dropping in the U.S. Our Benta Boutier reports that some small churches have had to make difficult decisions hastened by the pandemic.
Grammar Presbyterian Church opened its doors in 1907, but in November 2021, it held its final service. Amy Artis had served as the church's pastor since 2015. The congregation dwindled to 3 members this fall, making it hard for her to justify remaining open.
It was difficult. You know, as a pastor, you feel like you should stick with the church, you know, to help them, to be there for them.
Artis says while the pandemic hastened its closure, the church had been struggling to keep its doors open for a while.
Too often churches just get to the point where they find themselves ignoring the change. And that's what happened, I think, at Grammar. They just, the change around them with the pandemic, in some ways, was the overwhelming. And they couldn't get their mind around it. They couldn't see any light at the end of the tunnel.
The congregation had made efforts to increase its numbers. They got computers for an after-school study program and tried to start a food pantry. But efforts like these take volunteer numbers that smaller churches don't have. And Artis says as more people move to cities, retaining members and attracting new ones isn't easy. The 2020 U.S. Census shows that while counties in central Indiana saw population increases, some rural counties saw population drops as large as 5% in the last decade. Artis still preaches on Sundays at Scipio Presbyterian Church, about 5 miles from Grammar. She says Scipio absorbed a couple of Grammar's old members, but it's also felt the effects of the pandemic. She says Scipio Presbyterian had an average Sunday attendance of about 22 in June 2019, and it's dropped to 16 as the pandemic's gone on.
Small churches can be more open to things than large churches, but they can also be very steeped in tradition.
Deanna Howard had been a member at Scipio Presbyterian for 35 years. She says the congregation feels like family to her.
I liked, and I walked in the door here and people started talking to me right away. Asked me to sit with them. I think I found the place where I need to go that first Sunday.
Artis says part of the challenge in getting new members is that people have certain needs in mind when they look for a church. Arthur Farnsley isn't surprised to hear the pandemic's created challenges for small churches.
People are interested in programs for the elderly, for teens, for their children, for schools, daycares, recreational programs. When you get to really big congregations, they've got jazzercise and Pilates.
He says when smaller churches close their doors, it affects the community at large, especially in more rural areas.
Congregations fill a giant hole in the social safety net. They have clothing pantries. Even small congregations have food pantries. They are networks that can be mobilized when somebody needs help.
But he cautions against sounding alarm too early and says things typically happen more slowly in institutions as old as churches. Artis says even if the Scipio congregation can't grow in numbers, they still want to find ways to serve the community. Recently, they've given money to different causes, like equipment for a local playground, an animal rescue, and the Historical Society. The Scipio congregation is meeting this weekend to talk about its options for the future.
I think if you have more than 2 people together, you're going to have more than 2 opinions. We're trying to come to a consensus of, what is the church? What is the most important thing?
Artis says the key to their survival will be willingness to adapt and receptiveness to change. For Indiana Newsdesk, I'm Benta Boutier.
Hunting, fishing, and trapping licenses will cost more in the state starting this year. But as Indiana Public Broadcasting's Rebecca Thiel reports, the increased fees should generate about $4 million annually for the DNR's Fish and Wildlife Division.
Many individual hunting and fishing license fees haven't changed since the early 2000s, and several commercial ones have stayed the same since the 1980s. Lene Petercheff is the licensing and permit supervisor for the agency's Division of Fish and Wildlife. She says the fee increases will not only help keep the division running, but they'll also go to matching funds for federal grants, which could help more species whose populations are declining.
There's a research project being done on gray foxes right now and bobwhite quail, and we're hoping to be able to do more of those research projects, as well as work with more private landowners on establishing habitat on their properties.
The DNR created the new license fees by comparing them with fees in other Midwest states. Licenses for most hunting, fishing, and trapping activities in the state will go up for the license year starting April 1st. For Indiana Public Broadcasting, I'm Rebecca Thiel.
Now, some commercial river fishermen say the higher fees will hurt an already declining industry. The DNR has a list of how the different license fees have changed on its website. Well, that's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.